In this video, I will explain anatomy of tibia bone, its site determination and its important features. Tibia is long bone of our leg. It is median and weight-bearing bone of our leg. It consists of three parts: upper end, shaft, and its lower end. Let's discuss these parts one by one. Its upper end. Its upper end consists of two bony prominences. These prominences are named as medial condyle and lateral condyle. Superiorly, these two condyles have articulating surfaces. Through these articulating surfaces, these median and lateral condyle of tibia articulate with medial and lateral condyle of femur, and also with medial and lateral menisci, which is present between this tibia and femur, which is present above. And these two articulating surfaces are separated from each other through this intercondylar area. Let me show you its another view. This one is anterior intercondylar area and this one is posterior intercondylar area. These two areas are separating the medial and lateral condyles. And between these two condyles, there are two bony projections. These two prominences are named as medial and lateral intercondylar eminences. And on these eminences, there are present two tubercles which are named as medial intercondylar tubercle, and this one is named as lateral intercondylar tubercle. And near its upper end, there is a roughened area which is named as its tibial tuberosity. And its upper end consists of another facet. This facet is named as fibular facet. Through this facet, tibia articulate with this head of fibula. Its lower end is expanded from side to side and it is projected downward medially. This downward projection is called as medial malleolus. And laterally it consists of a depressed area. This depressed area is named as fibular notch. Through this notch, tibia articulate with fibula. This one is shaft of tibia. Its shaft consists of three borders and three surfaces. Its borders are anterior, medial and lateral border. Its anterior border starts from medial side of this tibial tuberosity, then moved downward, and at its lower end it becomes continuous with anterior border of medial malleolus. Its medial border starts below medial condyle, then move downward, and at its lower end it becomes continuous with posterior border of medial malleolus. And third and its last border, lateral border. It starts below this lateral condyle and in front of fibular facet. Then it moves downward, and at its lower end it becomes continuous with anterior border of this fibular notch. And there are three surfaces which are present between these three borders. The surface which is present between this anterior border and medial border, this surface is named as its anterior surface. And this surface which is present between its lateral border or introitious border and anterior border, this surface is named as its lateral surface. And third and its largest surface which is present between its medial border and lateral border. At its upper end, it is crossed by an oblique ridge which is named as its soleal line. It starts just behind its fibular facet, then moved medially and obliquely, and finally at the end become continuous with its medial border. Above the soleal line, posterior surface is in the form of triangular area, and below the soleal line, its posterior surface is further divided by a vertical line into medial surface and lateral surface. And just beneath the soleal line, there is a foramen which is named as nutrient foramen. This nutrient foramen is directed downward and it allows the passage of nutrient artery. And now its side determination. Its side determination is very easy. Its upper end is much more wider than at its lower end, and its anterior surface can be recognized from this tibial tuberosity, and its posterior surface has soleal line, and its medial surface at its lower end consists of this medial malleolus, and from these features you can easily determine its site. That's all about tibia.